You voted this week for what a lot of people are calling the most significant piece of health care reform legislation in generations. That bill also included a package overhauling our student loan system, but in a recent New Yorker article, you said that you've never been part of any organization that was so bad about talking about its accomplishments. How are you going to sell this work to your constituents in Virginia, and how should Democrats be selling it nationwide?
Well, I think we really have to bring this back to the kitchen table for folks. You know, there's been a big ideological debate in this healthcare process from the left and the right about, corporate accountability from the left and compassion about constitutionalism and communism on the right side. And for most people in the middle, this is just a very simple question. Is this going to save me money or cost me money? Is this going to shore up the system or is it going to undermine it? So I always think about that family of four making $40K a year, $60K a year, and how much are they going to save? My brother is a high school teacher and a coach down in Charlottesville, and he's got 4 kids, and not only has he been paying more and more every year, up to 20% more in a given year, but his school is paying more and more. So the fact is, for a family making $40K a year, they're going to save $7,000 a year under this plan, $2,700 of that out of pocket, the rest from the employer. For a family making $60K, you're talking about a couple thousand a year. That's real savings for a family. And I think a lot of people felt like this was a new entitlement program for the poor, which is actually kind of the opposite of that. This is about trying to force everybody to be a responsible part of the system and about savings going to the working and middle class. And then on the medical side, I think the issue is, we were on a path where we were choking out pediatricians, geriatric docs, primary care docs. We're shoring up a system to say to people in medical school, look, if you want to go into pediatrics, you're going to be able to make a good living off of that. It's worth going into. So I think we need to make this about that kitchen table, because that's where it is for most people in America.
That's the best spirited defense of the bill that I've heard.
Right now, health insurance companies make money by denying people care. That's the problem in the system. Their whole profit motive is based on the idea of they make more money by denying people care. What's interesting is they even build into their bottom line that if they can simply delay paying you for 12 months and make you sit on the phone calling and calling and calling, a certain number of people will give up. And then a certain number of people they'll eventually pay, but they literally take the interest payments, the interest on holding that money for 12 months and build that into their business model and bottom line. That is not something that works for healthcare. And think back. When you worked for one company for 40 years, you had one insurance company for 40 years. What did that mean? That meant their way of making money was by keeping you healthy. So you had a system that actually did the things you want a healthcare system to do. But now, certainly in my district, people will go in and out of a few different jobs over a decade and a few different insurance programs and often have gaps in between. Then the insurance company doesn't have an incentive to keep you healthy. They have an incentive to make sure you find out you're sick when you're on someone else's insurance. So what we have to do is get into a system where we're going to have a competitive place you can always go to access affordable private care, and make sure that competition is such that you can't make money by denying people care.
Peggy,